Welcome everybody, and thank you very much for joining us tonight. This is our PharmAssist MedTeach program brought to you by Mandel's Clinical Pharmacy, and we absolutely 100% appreciate all your interest in joining us tonight. Tonight we have our very special guest, Laurel Meier, who works in Sacramento, California. She has 13 years experience as an IVF case manager. And so, as you may know, we are joining through this program on both Zoom and on Facebook, so you feel free to ask any questions you have for Laurel in the Q&A section on Zoom, as well as in the chat on Facebook. We will have a couple of polls that may pop up throughout the course of the program, so feel free to answer those as well. And with that all being said, I'd like to turn it over to you now, Laurel. Thank you very much, and take it away.
Thank you, Craig. Thanks for the great introduction. My name is Laurel Meier, and we're going to be presenting 3 medications tonight. We're going to be presenting Gonal-F multidose. We're going to be presenting progesterone in oil intramuscular shot and Menopur subcutaneous. So what we're going to be doing, we're going to be showing videos, 3 videos, and we're going to have question and answer sessions after each video. So what I'd like to do now is just to talk a little bit about my background in infertility. I got interested in becoming an infertility IVF case manager because I myself went through infertility. It was a difficult process, and I have now 2 beautiful daughters, 16 and 20. So I stuck it out and I built my family. It obviously took longer than I wanted it to, but I encourage you to hang in there and you will get there too. So Craig, we can start the first video. Hi, my name is Laurel, and today I'm going to demonstrate the Gonal-F multidose vial. This is utilized for more than 1 shot. And you'll have everything you need for multiple shots in this 1 box. To start, what you're going to do is gather your supplies. You're going to have your powder. So we're going to use a little bit of imagination and imagine that there's a little disc of powder in here. You've got your pre-filled, your water, your sterile water, and you've got your syringe that you're going to draw it up with. So the first thing you're going to do is pop off the cap, and you're going to take an alcohol wipe, and you always want to alcohol the top of the vial before you do any mixing or drawing up. You're going to take the cap off of your sterile water, put it right in the middle, and put all of the water into the vial. And you're going to notice that there's a lot of pressure that builds up in there because you've just added a lot of water, a lot of pressure to this so that your syringe will go back up, and that's perfectly fine. This is all done now, and you put it straight in your sharps container without recapping. Then you're going to slowly just swirl this a little bit, make sure it's completely mixed, and you can put it up and down a couple times. You just don't want to shake it vigorously because that's going to create some air bubbles. Now you're going to take your needle and syringe. This already has a needle on it. So what you're going to do is find your dosage on the edge here. I'm going to use 300 because that's a common dosage. You're going to put 300 milliliters or units of air in there. And since I just alcoholed the top of that, I'm not going to do it again. Put the needle in the middle, push the air in, and then without taking the needle out, just invert the whole thing. Pull back till you have your dose. I'm going to use 300, as I said. If you have a large air bubble at the top, you can push it out and draw back again. And then push to the 300 line. Once you're at 300, you're going to reinvert and take it out. Now to give the shot, you're going to pick a spot on your abdomen It can be anywhere where you can pinch the fatty tissue, but stay at about an inch away from the belly button at least. Pinch your abdomen. Go in at a 90-degree angle, like a dart. Let go of the pinch and inject. Have a Kleenex handy so that after waiting about 3 seconds, you can pull out quickly and pull the Kleenex against your skin. Now, in about 3 seconds, you check your skin. If it's dry, you're done. If you see medicine leaking out or if you're bleeding a little, it's okay. Just keep holding until it's dry. Now, this is going to go in the sharps container. And this vial still has lots of medicine left. So you're going to want to put this in the refrigerator for your next shot. And that's all there is to it. All right. I encourage you to put in your questions through Facebook or through Zoom. And any question you can ask, someone else is going to appreciate it as well. Craig, are there any questions?
Yes, Laurel, this one's just coming in. It says, what do you do, or what should I do if I do not have enough left in the vial for a full dose?
Got it. So you're using the first dose, the first vial, but you're maybe on your second or third or fourth day of medication, and you pull up whatever you can, and you've used everything in that vial, but it's not enough. So what you'll do is you'll recap the syringe, you'll mix a new vial, you'll take your fresh vial, alcohol the top, and you'll draw up the remainder of your dose so you have your full dose in your syringe, and you'll give that in the abdomen. Then the rest of that medication that's in the vial that you've just mixed, that's going to go in the fridge for the following shot. Back to you, Craig. Any other questions?
Yeah, thank you very much. That was a great answer. We have a question coming in here that says, I'm planning on traveling this summer. How do I store the vial? Does it need to be refrigerated or put in a cooler while I'm in the car or getting in and out of the heat?
Good question. So the Gonalef, once it is mixed, needs to be kept under 77 degrees. So room temperature or refrigerated is both fine for 28 days. After 28 days, it needs to be discarded. But as long as it's not over 77 degrees, it's perfectly fine.
Perfect. Let's see. So it says, actually dealing with that question. So the question was, can it be stored at room temperature after it's mixed? How do I handle going back and forth between room temperature and refrigeration?
So as I said, any temperature below 77 degrees, whether it's out on the counter or in the refrigerator, is fine.
Great, thank you. So it seems like a bunch of questions coming in, also dealing with the idea of temperature. So we feel like we've covered that pretty well. And if anything comes in differently, I guess this is all great for people, like you said, Laurel, to know any question they're thinking of. Somebody else is thinking of a similar question, maybe just phrased a little bit differently. So throw anything out that you may have.
Sure.
One that just we have here is that talks about actually, how do I deal with injection beforehand? Do I need to ice the area before I inject? Is there anything I can do that can prevent possible pain or site reactions?
Good question. So what you want to do is pinch the skin. So let's say this is your tummy. You're going to give it a couple good pinches. And pinching the fatty tissue is actually going to trick it into not feeling the poke as much. Another thing you can do is ice the site for about 30 seconds. And that's going to numb the surface of the skin a little bit. And one of the key things in decreasing pain with injections is to give the medication slowly. If it's hurting, give it a little more slowly and it won't hurt as much.
All right. And this one actually is semi-related. I mean, we specifically talked about what you can do to prevent the pain, but this question has now come in that says, how painful is the actual injection itself? Obviously, I understand that this could be different per person, but is this going to be more or less painful compared to other shots that I've given?
So Gonalef is one of the least painful shots. Rarely do people complain about this one at all. It's a little bit of a pinch maybe with the needle going in, but the medication itself usually doesn't hurt at all.
Okay, sounds good. So it looks like we are good to go with questions as of right now. But one thing I always like to remind people that we will have a section at the end. If you just didn't get a chance or you're still thinking of a question, don't feel like you have to rush right now. We will have a section at the end where any questions for any one of the three products can be asked at that point in time. So feel free to shoot any questions out that you may have into either the Facebook chat or into the Q&A section of the Zoom as well, and we will certainly get to all questions as they come. But other than that, we're good for right now, so I'll throw it back over to you, Laurel, to get started for the next product.
Okay, so the next product is progesterone in oil. This medication is given intramuscularly. So back to you, Craig, to start the video. Hi, my name is Laurel, and I'm here to show you how to draw up and give the progesterone in oil. Progesterone in oil is used to maintain the uterine lining during usually a frozen embryo transfer cycle. Also, if you're going to have a fresh transfer, it's typically started on the day of egg retrieval or possibly the day before. Just follow your instructions from your clinic on when to start this. So progesterone in oil is a fairly thick medication. You want to pop off the top and use an alcohol wipe to clean the surface. And then you're going to take your needle and syringe out of the packaging. The typical dose is 1 ml. So I would draw up, you draw up 1 ml of air first, and you take off the top. Inject this into the center circle. Inject the air in, and then invert. You want to pull back so that the tip of the needle is in the oil, and then pull on the plunger. As you draw back, the oil will leak down the side. Now, what we do is we have you draw up and give with the same needle. It takes away a step of having to use a draw up needle and then an injection needle, but it does take a little longer to draw it up, so you just have to be really patient as it drips down the side very slowly. Feel free to pull really hard on the end of the syringe there, because that's going to create that vacuum and pull that medication out. So if you get a little bit more than one, that's okay. You're going to push the air in and go to the one line. If you don't quite have one, you can pull more and then push back to the one line. So there's one. Little teeny bubbles you can ignore. And now you're ready to give the shot. Now I'm going to recap this because we're going to go over a few things about giving intramuscular shots. This is not a belly shot. This is the one that's given in the upper outer quadrant of the hip. And it's given for many, many days, even many weeks at a time, because it's important in maintaining the uterine lining. So your hips are going to get sore. Now, the actual shot doesn't really hurt any more than the shots in the belly, but it does make your hips sore. So you're going to give a shot on one hip one day. The next day, you're going to switch to the other side, and you're going to go back and forth each day. Prior to giving the shot, if you'd like to ice the hip a little bit, that works. You can use some lidocaine cream or a Synergia patch to decrease the pain. But one really good way of just tricking the skin into not feeling the poke is pinching the skin really hard. And if you pinch it several times, it's going to trick the skin into not feeling that poke. Now, as the person that is receiving the shot, you want to make sure your hip muscle is completely relaxed. And the best way to do that is to lay on a bed, flat on your stomach, and just relax. If you point your toes inward, it's going to keep you from being able to tense your hip muscle while you're receiving the shot from your partner. Another way you can receive the shot is by standing and putting all of your weight on the opposite leg from the side you're receiving the shot. And that works fine too. Your partner can sit in a chair next to you while you're standing. So to give the shot, you want to uh, get in the correct position, and your partner is going to pinch your hip many times and nice and hard. And with a good hard pinch, it's going to go, he or she will go straight in like a dart, all the way to the hub. Let go of the pinch. And then you're going to inject this medication all the way. And it does take a little bit of time because it is a thick oil going through a skinny needle. Once all the medication is instilled, you're going to take a Kleenex, you're going to pull out and hold very firmly against the skin. After about 30 seconds, you'll check, is there any medicine leaking out? Is it bleeding? If not, you're done. If there is, just keep holding it until it's dry. Now, your clinic may have you draw up this medication with a larger bore needle. It's called an 18 gauge. If they do, I want to make sure that you know that you don't give the medication with this, because this is very thick, as you can see. So you would draw up with this, and then you'd switch over to the skinnier one to give. Now, in our clinic, we just have you draw up and give with the same needle. As I said before, it takes a little longer to draw it up, but it does remove a step. So just follow the instructions of your clinic. This will go in your sharps container. Your progesterone will be good for usually for 10 days. It's a multi-dose vial, so you're going to put this away. It does not get refrigerated, so just keep it in a safe place for next time. That's all there is to it. Okay, I encourage you to put any questions in about progesterone and oil now. Craig, any questions coming in?
Yeah, so this one is a bit of a two-parter. So it says, when I pull back on the plunger after I insert the needle to check for blood, what do I do, A, if I find blood in the needle, and B, how do I ensure that I'm not still in the vein after pulling back?
Okay, good question. So I didn't go over the pulling back on the plunger. This is called aspiration, but it is something that your clinic may ask you to do. It is a debate right now on whether or not it's important to do, but I'd like to go over aspiration and how to do it and what happens if you get blood in the syringe. So aspiration is the technique of pulling back on the end of the plunger once the needle is in place in the muscle. And if the tip of the needle is lodged directly in a vein, then you're going to see blood come back into the syringe when you pull back on the end. Now, if you were to give the medication, at that point, the medication would go straight into the vein, which you don't want to do. But this is extremely, extremely rare. So one of the things to know is that that there is a vein that goes through this muscle that you can hit. As I said, it's very rare. And you may be asked to do that aspiration with this injection site. This injection site is on the side of the hip. It is found by just making like a peace sign with your fingers. The tips of your fingers are on the edge of your hip bone, and you can give that injection anywhere in between those fingers. There is no veins large enough to cause any problems there, so there's absolutely no reason to have to aspirate with that site. So just so you're aware that you can use either site, they're perfectly fine for progesterone and oil. Now, if your clinic says, to aspirate, then I would recommend doing that. And if you do choose to aspirate and you do get the blood, what you're going to do is you're going to pull out and hold the site. You're going to recap, put a new needle on, and then you're going to switch to another site to give that shot. And it's perfectly safe to give the shot with a little bit of your blood mixed in it. I would recommend using the side here so you don't have to aspirate again. But it is completely safe. Back to you, Craig. Any other questions?
Yes, actually, one question. Thank you, first off, for that very well succinct answer to a question that I think has come in quite a few times already. So we appreciate making it simple and easy, so people realize that it may not be as intimidating as you may have heard. So we appreciate that. This question just came in on Facebook that says, this is from Adeline, said, wouldn't pinching not allow for the needle to reach into the muscle?
Good question. Okay, so there is that technique where you spread the skin and you go in and you get to the muscle. But if you pinch first and you go in, you're going to let go of the pinch, and you do have to push a little bit when you've let go to keep that hub against the skin. And that way you ensure that you are in the muscle indeed. Hope that answered the question. Back to you, Craig.
Yes, thank you very much. Okay, so now, again, it seems like a lot of questions around the painful side, and you touched on some of this stuff, but just to clarify for people, I've been told that these injections are very painful. Can I use heat or ice to alleviate the pain? How do I handle any potential itching that may occur at the injection site?
Itching, yes. Okay, so ice before, as I said, about 30 seconds on the skin surface is going to numb it a little bit. You can use heat afterwards, and we do recommend that you either massage the muscle a little bit and or apply some heat with a heating pad or other form of heat. Just make sure you don't use the heating pad for very long. And then we do recommend that you give the shot in the morning so that you are using your muscle all day. And that really is the key to getting that progesterone oil to absorb into the bloodstream slowly, and that you don't get any knots that develop. As far as the itching, some people do have an allergic reaction. This is a mild allergic reaction. It causes itching at the site, can cause redness, swelling, and can be quite uncomfortable. So if this does get to be a problem, you can call your clinic and you can ask them if they can order the progesterone in a different base. The progesterone typically comes in sesame oil, and that is what you would be reacting to, is that sesame oil. So you can have that ordered in a different base called ethyl oleate or olive oil. And the ethyl oleate is nice and thin. It's a little bit more expensive, but it has very little reactivity for people. So that's a great option.
Great. Actually, a follow-up question that came in on that, just regarding the using heating pads. You said not to use it for very long. What's the right amount of time that people should utilize heating pads to prevent pain without causing a problem?
I would say 20 minutes max.
Perfect.
On low.
Okay. Yep. Sounds good. Thank you. All right. So now, how do I store this medication in between injections? Pretty straightforward question there. That came in a couple different ways.
So yeah, don't store it in the refrigerator because it is oil-based. It's going to get too thick. You just want to keep this at room temperature. So a safe place in the cupboard is fine. Oh, and one more thing related to the thickness of the oil. If you want to put this vial in your front pocket for about 20 minutes prior to drawing it up, it will liquefy a little bit. It will make it easier to draw up and give. And then it doesn't hurt it at all to warm it up a little bit first.
Great. Oh, that's great. Thank you very much for that little pro tip there for people to make it as easy as possible. We appreciate it. And so this is a pretty straightforward, kind of very basic question, and we see these come in on quite a bit, but a lot of people might be confused. What does this medication actually do as part of the cycle? You touched a little bit on it, but to just get into a little bit more of the specifics there would probably be helpful for some people.
Sure, yeah. So it's used for a frozen embryo transfer cycle and or a fresh cycle where you're doing an embryo transfer, as I said in the video. And what it does is it prepares the uterine lining to be receptive to the embryo, and then it maintains the uterine lining for the growth of the embryo. And naturally, your body does not make enough progesterone when you have a medicated cycle like this, so we have to have you take the progesterone as a shot to keep that uterine lining healthy until about 10 to 12 weeks of pregnancy.
Thank you for explaining that. That is very helpful for a lot of people that sometimes we just have questions about how to use the medication, but other times we want to know how is the medication working and helping us and why are we on so many different medications. And that's very helpful for a lot of people. So we appreciate it. And then this one actually this might be a follow-up to some of the earlier questions that came up, but there's a question here that says, how do I know if I'm actually inside the muscle when I'm giving a medication such as this?
Well, the length of the needle is 1.5 inches. And so as long as you're injecting up to the hub, which is the end of the needle, as long as you're injecting the entire needle, you will be in the muscle. If your BMI is less than 20, however, you only need a 1-inch needle and you will be in the muscle.
All right. Thank you very much, Laurel. I appreciate it. That is all the questions we have coming in so far. So again, I just want to remind anyone who may be joining us a little bit late that we will have a section at the end to answer questions about all 3 of the products that we talked about today, the Gonal-F multidose, progesterone and oil, and the 3rd product coming up in a minute. So feel free, if you have questions that come to you over time, you can jump back and we will cover all 3 of those products. But as of right now, we are wrapped up. So I'll throw it back over to you, Laurel, to move on to the next product.
Okay. The next product we're going to go over is called Menopur. Hi, my name is Laurel, and today I'm going to demonstrate how to mix and give the Menopur. Menopur comes in little powders, and we're going to use our imagination and we're going to pretend that there's little white discs of powders in these vials. You'll also need a container of saline, a Q-cap, which is a needleless mixing device, a 3 ml syringe, and a small needle for giving. So make sure you have all your supplies ready. And the first thing you're going to do is take the caps off of your supplies. Now, some clinics are going to order for you 1 vial of Menopur. Others will give you 2 or 3. So just follow your clinic's instructions on how many vials of Menopur. Each vial is 75 units of medication. So if you're told to give 150 units, that would be 2 powders. You're always going to be able to mix this Menopur and give it as 1 shot. So the next thing we're going to do is to peel that off. The Q-cap will go directly on the liquid. Just pop it on and take the plastic covering off so it looks like this. Then you're going to take your 3 ml syringe and you're going to put 1 milliliter of air in the syringe and you're going to twist it onto the Q-cap. Now, keeping it on a hard surface, you're going to push the air in and invert it. Draw up 1 milliliter of the liquid. So you go a little past the 1 and you push the air out until you're right on 1. Pull off your liquid and put it to the side. Now we're going to pretend to mix the powder. So here's the first powder. You push the Q-cap on, you inject the liquid into the powder, and you swirl it very gently. This powder will instantly dissolve. Now, if you have a second powder that you need to dissolve, you're going to push the air in while it's inverted, pull everything back into the syringe, take the empty vial off, put it to the side, and then do the same thing with the second powder. Push it on, inject this into the powder. It will dissolve immediately. Swirl a little, turn it upside down, push, and pull all the liquid back into your syringe. Now, when you're done with all of the powders that you've been told to inject, you're going to twist everything off while you're still pointing your syringe at the ceiling. And you're going to take your small needle and you're going to add the needle. The needle goes on like this. Twist it on, pull the cap straight off. And now it's time to get rid of that air. So just push until you see a drip of liquid at the tip. And you're ready to give your shot. So this is given in the abdomen. Pick a spot, stay an inch away from the belly button. Don't inject into a spot that has a bruise from a previous shot. Anywhere you can pinch some fatty tissue, just give it a pinch, inject straight in at a 90-degree angle, let go of the pinch, inject your medication, wait 3 seconds, grab a Kleenex, pull out, and hold with the Kleenex. After about 10 seconds, check your skin site. If it's dry, no bleeding, you're done. If it's bleeding a little medicine's leaking out, just keep holding it until it's dry. Everything goes in a sharps container, and your next shot, you're going to get a whole new supply. That's all there is to it. All right. Please feel free to put any questions you have in about Menopur. Any questions coming in, Craig?
Yes, so we have one here about the mixing. Can I use more or less than the 1 ml of the saline to mix the Menopur, or does it have to just be the 1 ml?
Good question. So if you're using one powder, if you would like to use 1/2 of a milliliter, that's perfectly fine. That's enough to mix the one powder. We recommend using 1 milliliter for any amount up to 4 powders at our clinic. If you have more than 4 powders, which is highly unlikely, you can use a little more liquid. However, the way to minimize the pain with this is to just give this shot very slowly. If you use you can use up to 2 milliliters of liquid if you want, but the more liquid you use, I think the more painful you're going to find that it is. So the key is to give this one very slowly, because this one does tend to sting a little bit.
Okay, thank you. Yeah, that actually came in. You just answered a second question came in that was about if I use more or less. I heard from a friend that I can use more or less liquid to inject to make it less painful. Is that something you've seen before? So you did just touch on that. That's very helpful for people to know that the more liquid could actually cause that. So good to know. This other question just came in. We've seen this one before as well. My Menopur vial looks more like a solid tablet or a pill, an actual pill, than a powder. Is this okay?
Yes, the Menopur typically looks like a compacted disc of powder, like a little tablet in the base, and that's perfectly fine. If it looks just like loose powder, that's okay too.
Okay, sounds good. And then somebody was asking here, do I have to use the Q-cap? I have both the long and short needle for it. Does it matter if I mix with one of the needles or the Q-cap itself?
You don't have to use the Q-cap. It's a really nice needleless mixing device, so it decreases your risk for getting poked. But if you prefer to use a needle to mix it, that's perfectly fine. You would just put your mixing needle on the syringe first, pull up your 1 milliliter of liquid, put it into the powder, drop back into the syringe, and keep repeating that process until you have the right number of powders dissolved and back into your syringe. And then you would switch over to the little needle, point it at the ceiling, get rid of the air, and then you can give that in the belly.
Thank you very much. Okay, I appreciate it. So as of right now, we have no other questions that have come in yet. Again, if you have any questions at this point about any one of the 3 products, the Gonal-F Multidose, the progesterone in oil, the Menopur, feel free. You can hop into the Q&A section of the Zoom if you're on there, as well as also you can jump in to the Facebook Live where we have a chat going, and you can put in any questions you may have there as well. But as we give people some time, just in case, we've had quite a few questions came in today, so I do want to throw it back over to you, Laurel, just in case you have anything else you want to share, anything else you want to last minute information you want to share with the group who have joined in tonight.
Well, I do want to encourage everybody to just hang in there. I know that it's intimidating to give yourself a shot, or the the brain tells you that you shouldn't hurt yourself. And there's this very strong pull, this urge not to give yourself a shot. But just know that if there's a greater good here, and just overcome that fear. And you will find once you've given your first shot that it's not nearly as difficult as you imagined.
Well, thank you very much, Laurel, for all of that. We appreciate it. A part of this whole program is to not only just let people understand a little bit more about what their shots are, have some questions about how they take their different medications, what they may be, but also to make them feel comfortable with the entire process. And we certainly know you have done that tonight. So thank you so much for guiding us through this entire MedTeach. The PharmAssist program is all about that. It is every Monday night at 7 p.m. Eastern Standard Time. We are both on Zoom as well as Facebook Live. Our goal is really just to be here for you to answer your questions, walk you through some of the different products that are out there, but also really to let you know that you're not in this alone, that there are other people who have the same questions and concerns as you, and that things are really going to be much more simple than you may imagine in your mind. So thank you so much, Laurel, for everything tonight. We appreciate your time, your expertise, your very comforting vibe that you've shared with us tonight. It's been great. And we open it up to everyone just to know that you can find all of these videos, including this full MedTeach, on our YouTube page, our Facebook page, and you can also find it on our homepage, mymandelsPharmacy.com. There's a link there to get to all of the different live shows. So if you're watching this after the fact, if you're watching like a recording of this on demand, you can also join us on next Monday at 7 p.m. Eastern and ask them questions of your own. We will have experienced nurses from all across the nation, such as Laurel, who can share their stories and share their expertise with you. But with that, I want to say thank you very much, everybody, for joining us tonight. And I'll allow you over to you, Laurel, for just to say good night to everybody.
Okay. Well, thank you for joining us. It's been a pleasure, and good luck to everybody. Bye-bye.
And with that, there are a couple of questions, some polls, if anyone has some time that they can share with us just to give us some feedback. And we will see you next Monday night at 7 p.m. Eastern. Thanks again, everybody, for joining us. This has been another version of the PharmAssist MedTeach program brought to you by Mandel's Clinical Pharmacy. And thank you again, Laurel, for your time. And we will see you again next week.